EEG and other diagnostics, they tend to have different uses and usually answer different questions. So speaking broadly, again, EEG's strength is that it can tell you what's going on during a task or during an event in real time by measuring electrical activity and brain rhythms. But EEG cannot tell you much about what goes on beneath the surface of the electrical activity in the brain. EEG also has the advantage of having a very long track record of being completely safe. There are no known side effects to EEG. It's completely non-invasive. And going back to MRI, MRI is best for obtaining detailed images of brain anatomy. So if you want to get a picture of an entire brain, the cortices and the deeper structures, you can do that. You can measure their volume. fMRI will be able to tell you about blood flow increases and decreases in these areas. This is on a macro level. MRI, it can't see individual neurons or assess real-time electrical activity. It's sort of inferring how the brain works by associating these cognitive processes with changes in blood flow. So MRIs work by using very powerful magnets to align protons within tissue. And these movements and disturbances create patterns that are picked up by the scanner and then translated into detailed images. MRI has no known side effects. It's considered very safe. A CT scan, computerized tomography, uses powerful multi-view X-ray technology. This produces anatomical views of the brain and other body parts, just like MRI could. You can detect tumors, for example, but it tells you nothing about small details or how the brain operates. CT scans also, unfortunately, involve a rather large dose of radiation. PET technology, or Positron Emission Tomography, is actually involving injecting short-lived radioactive material that it's traced with gamma waves as it moves through the body. So it can give you images of metabolic information, and the radiation exposure is more limited than CT. But to measure single neurons, you need to use those deep brain stimulators or single-cell recording apparatuses that insert needles down into the brain. This gives you amazing detail, but it involves surgery and significant expense and significant risk. So it's not as common as the other techniques and not very helpful for diagnostics unless you're in a bad way. Some of the other advantages of EEG over some of the other imaging equipment is that it's transportable, silent, non-invasive. It's not enclosed, which is relevant for people with claustrophobia. Going into an MRI usually involves sliding into a tunnel. And it's not impossible on patients with certain metal implants like pacemakers. For instance, again, the MRI is a very powerful magnet, so certain people can't use it. EEG is somewhat tolerant of muscle movements. It involves no radiation. Just like EEG, MRI can be corrupted by movement in the scanner. EEG can also detect covert processing and ongoing processing, which is nice in cognitive studies if you don't want to blatantly tell someone what you're looking for and then hope that doesn't influence the results.